So Crystal MIZE is our speaker today on our PCA guest lecture series, and Crystal is an affiliate in the Department of Psychology. She's an experimental psychologist at Florida Atlantic University, and she also happens to be a person with posterior cortical atrophy, which is what we all are here for. So Crystal is going to be talking today about promoting emotional well-being and brain functioning with meditation. Unfortunately, Bonnie Wong, who's a neuropsychologist at Harvard Mass General, who co-facilitates my support group, was going to be on today, but she had a patient conflict, so she apologizes, and we are in fabulous hands with Crystal. So Crystal, thank you for being with us today and talking to us about yourself and your science.
Okay, so as Jamie said, I'm Dr. Crystal MIZE, and I'm an affiliate with Florida Atlantic University. After having a series of some kind of strange symptoms, I decided I needed to step down from teaching. I have remained involved in my research as a volunteer and kind of guiding some of the students in their projects. And then last August, I was given a diagnosis of PCA, which answered a lot of questions. I have, however, continued working on my research because it's important to keep our minds active even when we're suffering from this brain atrophy. And one of the things that's become even more interesting to me from my research is meditation. So today I'm going to be talking about some of the research that I've done with meditation and then how that fits in with depression and anxiety. A lot of people in the group have indicated that they suffer from depression and especially anxiety. And so I'm going to talk a little bit about the statistics of that, how frequent it is, and then introduce you to EEG, a physiological measure that I use to look at what's going on inside the brain. And then I'll talk a little bit about a recently published article, mindfulness meditation interventions, and how it alters the neurophysiological symptoms of anxiety and depression. And then I'll talk a little bit about how that fits into the larger research base and why you should meditate. And then we were going to have Bonnie lead a meditation, but I'm going to just talk a little bit about breath meditation and how to do it at the end. Okay. So again, depression and anxiety, in talking with a lot of you, I've found out that that's a huge concern to many of you. It's not surprising because depression and anxiety are common mental health disorders. There's over 264 million people worldwide who suffer from depression. And about 1 in 13 people struggle with anxiety disorders. Now, what's even more distressing about this is that with depression, only about 15% of that 264 million people are getting treatment. And with anxiety, only about 33% of the individuals who suffer from anxiety disorders get treatment. Now, the reasons that people don't have treatment is one, financial concerns or lack of medical insurance. There's the issue in some countries where they really just don't have access to treatment for these conditions. We also have people where they're treatment resistant, and so the medications don't actually reduce the depression or the anxiety to acceptable levels. And then, of course, a lot of people have side effects to the medications that we use to treat depression and anxiety. One of the areas of focus that I look at is development across the lifespan, but I look at children and even infants a lot of times. And children and adolescents are at an increased risk for psychiatric disorders. So about 3% of the children in the US are diagnosed with depression and about 7% with anxiety. And again, another very concerning statistic is that anxiety disorders can have an onset as early as 7 years old. And part of the issue with this is that oftentimes kids who develop anxiety disorders or depression early in life go on and continue to have those symptoms in adulthood. So in fact, about half of our mental health disorders actually begin before we even enter adulthood. So in my research, we're actually interested in kind of intervening early on in life to try to change this a little bit. Now, as I mentioned, one of the methods that I use in my research to examine the brain is the electroencephalogram. This is a machine that we call it the EEG. Maybe some of you have had an EEG reading. So what the EEG is it detects the electrical activity that's generated by the synchronized firing of the neurons in the brain, but it can tell us about your brain health. And so there's distinct patterns associated with depression and anxiety when we look at the EEG. So the characteristics of the EEG waves or activity are the frequency. This is the speed of the electrical waves. And your brainwave patterns, they really do look just like a sound wave or other wave patterns. We measure them in hertz, and 1 wave cycle per second would be 1 hertz. So that's the frequency. It's the speed of the electrical wave, or how many waveforms are occurring in your brain in a second. So the frequency of the alpha brain activity is about 7 to 12 hertz, or 7 to 12 waves per second. When we talk about power, we're talking about the amount of activity in the frequency bands. So for example, how much of the relaxed alpha activity do you have going on in your brain? Or is that alpha activity being overridden by a more active brain wave, the beta wave? Well, that beta wave is associated with anxiety. So one of the things that we like to do is try to shift your power, the amount of activity, toward that more relaxed alpha wave. And we found that meditation can do that. Another thing that we look at is the amount of activity that's going on in the brain on the 2 sides of the brain. So you have the right half of the brain and the left hemisphere of the brain. And when you have more alpha activity in the frontal lobe on the right side than you do on the left side, when you have that asymmetry, that's actually associated with depression and anxiety. So looking at the asymmetry of the waves gives us a lot of information about the brain. And finally, we look at coherence. This is the coherence between the different electrodes. It reflects the degree of the neural connections that are present across the regions of the brain and how efficient those connections are. So for example, how well are the neurons in the frontal lobe of your brain communicating with that visual cortex in the occipital lobe of the brain? We also look at how many nodes, how many times how many short connections are there from the front to, say, the parietal, the middle part of the brain, before it gets back to that occipital lobe, because that's going to slow down the activity. So one thing I wanted to mention, that PCA patients, we seem to have reduced connectivity in the brain and the communication between our symptoms. We also have less alpha activity. And one of the things that meditation does is help us build up that alpha activity. So even though I looked at kids, this is very relevant to those of us that have PCA. So I've mentioned those EEG frequencies. I've thrown out that alpha a few times. The brainwave patterns that we see in the brain, they have different shapes and different frequencies. And it depends on what state of mind you're in, which frequency is going to be more dominant. So I'm just going to briefly talk about this. We have the delta, high amplitude, low frequency wave. And this is about 0.5 to 4 hertz. That means that you have no more than 4 of these delta wave cycles in a second. We see this in the deep sleep state, and it actually stimulates the release of growth hormones. Babies spend a lot of time in sleep, and part of what's going on is that their brain is releasing that growth hormone so that they can develop. We actually see a lot more delta activity even in the awake state in children up to about age 5. Delta activity also plays a role in memory formation. So getting deep sleep is important. You need to have this slow wave sleep to help you really set those memories into the brain. The next waveform is the theta. It's about 4 to 7 cycles per second. And we see this as we're coming out of sleep. It's linked to memory formation as well and spatial navigation. Theta activity also is related to controlling anxiety. So we like to see some theta activity in your brain waves. The next brainwave activity is that alpha, and it's a much quicker brainwave. It's shorter than the big delta, for those of you who can see that. The alpha wave is about 7 to 12 cycles per second, and it's when we're awake, but we're relaxed. And again, people with posterior cortical atrophy have a decrease in this alpha, especially in the posterior region. So these alpha waves are prominent when your sensory inputs are minimalized and your mind's generally kind of rid of unwanted thoughts. When your brain shifts gears to focus on a specific thought, either positive or negative, it's going to move away from the alpha activity and into the quicker, the higher frequency beta activity, which is about 12 to 30 cycles per second. And these beta waves are great for our everyday consciousness. They're present when you have an active thought going on, when you're kind of focused, and that's great. But when you get stuck in that focus on a certain thought or emotion, then you can have anxiety. So meditation can promote moving away from this beta activity back into the alpha activity, and also shifting your brain activity toward the left hemisphere, which again is associated with less depression and less anxiety. Meditation also increases that theta activity, which is involved in regulating anxiety. The final waveform is the gamma. This is greater than 30 hertz or 30 cycles per second, up to about 100. It's associated when your brain is simultaneously processing a lot of information from different regions of the brain, and it does it very efficiently. But you need to be able to quiet your mind and focus when you're learning new information, for example. This is a deep concentrative state. And in fact, meditators who spend a lot of time meditating, for example, the Tibetan Buddhist monks, when we look at their brains, they have a lot of gamma activity, both during their meditation and also when they're at rest. So this is a deep rest state also. And some people would even indicate that when you're in this state, you're not focused on the self or the other, and that you transcend the feelings of time and space. So reaching gamma state activity can be very beneficial for being calm and releasing some of that anxiety. Okay, now I'm going to move on to just a little bit about my specific studies. So I did look at children in this study. Their brains are not fully developed. They're wiring up. They're very plastic. They're very malleable. And this makes them susceptible to effects from negative stimuli as well as positive experience. And with that huge amount of depression in our society, a lot of our kids are growing up with parents who have depression, and that can put them at risk for depression and anxiety. And in fact, we even see that newborn infants of depressed mothers already have a brain activity that is in line with being depressed. So children can be born at risk for depression and anxiety. It's a result of our genetics, our brain chemistry, our personality, and our life experiences. So basically, if a kid is anxious or depressed, then the pathways in their brain that are associated with those conditions are going to strengthen over time. But as I mentioned, their brains are very malleable, they're very plastic. And so our goal is to promote healthy development in these kids and to give them some positive experiences and to provide them with a tool for dealing with stress early in life that can kind of prevent them from moving forward into the full stages of depression and anxiety. And one of my students brought to my attention that mindfulness meditation has shown improvement for depression and anxiety in older populations, but we weren't seeing a lot of research in children. And then we started seeing a little bit in adolescents, but again, not the younger kids. So what we decided to do was to look at a 10-week meditation practice intervention in 7 to 10-year-old children. We used a pre and a post-test design, which means that we collected information on their depression and we collected EEG data before we even introduced them to that meditation. We then had a professional meditator, someone who used meditation for 20 years and used it in their therapeutic practice, come in and teach our teachers, as well as some of our student research assistants, how to meditate. And then they took that to the classroom and taught the children how to meditate. And our kids were doing just 15 minutes of meditation in the classroom for 10 weeks. So what we found was that there's different types of meditation, and they tend to kind of fall into 2 categories: focused attention meditation and open monitoring meditation. So the focused attention meditation involves an intentional focus. You want to guide your focus, and it helps regulate attention, and it builds the parts of the brain that help you regulate your attention. It strengthens your ability to identify when your mind is wandering. So sometimes you're doing something, you're driving maybe, if you still drive, and you realize that your mind's wandered and you didn't even notice it. So it helps you identify that mind wandering and then strengthen the ability to disengage from the distractions and refocus your attention. So what you do in a focused attention meditation is you select an anchor. It can be anything. It can be a sound. It can be a sight. It can be something on your body, focusing on how you feel in your body, or breathing. And often we choose breathing as our anchor because it's always available to us. So we direct our attention to that anchor and focus on the natural rhythm of our breathing. And then again, this can get kind of boring, especially for second and fourth graders that we were working with. So we acknowledge that the mind wanders. That's okay. We acknowledge those distractions, but then we gently bring our focus back to our anchor, that breathing. And to help us anchor, a lot of times we'll count with the breathing. So we'll breathe in and then out, 1, and then breathe in and out. And on the out, they would count 2. We had our kids count up to 10 to keep it simple for them and then start again. Now, the other kind of attention, the broad overview of a second kind of attention, is open monitoring meditation. In open monitoring meditation, you're very receptive to everything, your internal thoughts and feelings, the external sensations, the lights that are buzzing around you. You're kind of open to everything. You let your thoughts arise naturally and then fall away as they're replaced with new ones. So we have to be very aware of our thinking in this open monitoring. But we're also acutely aware of the present moment, and we want to be non-reactive to that present moment. And as we do this, as we train our brain to be non-reactive, it leads to a gradual lessening of self-identifying with the emotions that we're having and taking them personal, and allows us to really just kind of sit back and watch. So in open monitoring, you want to be an impartial observer. So just like the clouds are floating by in the sky, you can't control that. You just sit and watch it float by. Or as the sun's rising, you can't control it, and you're probably not going to be judgmental of it. Or as waves are coming in at the beach, they're coming in and returning to the sea. You don't control this. You just are an impartial observer. So we try to tell people with open monitoring, you want to get to the point where you're peacefully watching your stream of consciousness in the same manner. You don't control it. It just happens. You observe it and then move on to the next cloud or the next thought or the next emotion. So you allow your sensations to occur and unfold without evaluating them. You're just an objective witness to what's going on in your stream of consciousness. Okay, so in our research, we actually combine these two, and this is common in mindful meditation, especially at the beginning for novices, is you have them have an anchor, but you also allow them to have that open monitoring. So we told our students, and this is what you would do if you were going to be meditating, you sit up straight comfortably, you fold or lay your hands in your lap, and you want to either look slightly down in front of you or close your eyes. Some people aren't comfortable closing your eyes, and that's okay. You can just look slightly down in front of you. You take a few deep breaths in and out, and then you just focus on the natural rhythm of your breathing. This is the focused attention part of this mindfulness meditation. So again, we had our kids count the exhalations in sets of 10. So breathe in, 1, breathe out, breathe in, 2, breathe in, 3, and just in a natural flow. And again, it's common when people are first starting to meditate that they have these distractions. So we acknowledge those distractions without suppressing them or judging them. You just let them pass by. You might observe them as you would watch a bird fly through the sky. Again, you don't control it, you don't suppress it. You watch it fly by and float out of your consciousness, or like a leaf floating down the stream. And when this distraction happens, again, you watch it peacefully, you don't judge it, and then you gently guide your focus back to your breathing, that anchor. So start counting your breathing again if you've lost your focus. So we had our kids do this about 5 times a week for 15 minutes under the guidance of their teachers and a research assistant in the classroom. We asked them to also do it on the weekend, but of course we weren't sure if they were doing that. Some did, some didn't. But at least 15 minutes for 10 weeks. That's all these kids did. Now, what we were looking for in this study were EEG correlates of anxiety and depression and shifts away from those. So for example, the frontal alpha asymmetry, where we have relatively more alpha activity happening on the right side in the frontal area of the brain than the left side. That's associated with anxiety and depression. We also see lower levels of theta, alpha, and beta power in the frontal and the central, the top parts of the brain. And these depleted levels, they interrupt regulating anxiety. We have less relaxation. Our attention is not as good. And we also tend to ruminate when we have this lower level alpha, beta, and theta levels of power going on. In people who have anxiety and depression, we also see a reduction in the long-range coherence. That's the communication, the efficiency of the communication between, for example, the frontal and the occipital lobes. And when we see reductions in this long-range coherence, that's associated with anxiety and depression. So what we expected, because meditation seems to make anxiety and depression better, is we expected a shift in the asymmetry levels, as well as increased power and coherence after our kids had their meditation, the 10 weeks of meditation. And in fact, what we found was that there was a significant reduction in depression. So our kids dropped about 6 points. They went from being on average in the depressed level to a much healthier level. So depression dropped significantly, which is shown in this graph here, if you can see it. We did not find a significant effect for asymmetry, that moving of the activity to the left side of the brain. And one of the reasons we think we didn't find this effect is that our kids were just barely depressed. So this was not a clinical sample. It was just a regular school-age child. And so on average, they were just barely depressed. And when you're just barely depressed, there's not a lot of room for movement for that frontal asymmetry. But we did find increased alpha, beta, and theta power in the frontal and the central regions of the brain. And we also found an increase in coherence. That means that we had that enhanced communication between specifically the frontal and the parietal, and the frontal and the occipital regions of the brain. So they had better communication in their brain. They had more power or activity in the ranges, the alpha, beta, and theta frequencies. So this is all in line with what we would see with that drop in depression. And in fact, some research has suggested that by increasing our resting theta power, that it can have a comparable effect as an antidepressant pill. So doing this meditation and increasing that power is very important. But overall, what our findings suggested was that mindfulness meditation training does have potential to alter brain functioning, even in children, because we were really just seeing this in adults, and also to reduce their depression symptoms, hopefully giving them a kind of a natural protection from depression and anxiety later in life. So another thing that we saw, and I'm just going to briefly talk about this one. This one's just under review for publication, so it's not out there yet. But we did replicate in a second group of kids this drop in depression scores. So a significant drop in depression scores after 10 weeks of meditation when they had never been exposed to meditation before that. And we saw changes in the EEG activity, specifically the alpha power and another ratio, the theta beta ratio, so more theta activity. We saw differences in these, and these two EEG patterns actually predicted that drop in depression. So it does seem that it's the meditation changing the brain that actually is responsible for that drop in in depression and anxiety. The other thing that we saw was that our kids became more creative. We had a measure of creativity, and after 10 weeks, they actually scored much higher on the creativity measurement also. But the important thing here is that we saw a replication of our previous results, and that the changes in the brain actually do predict a drop in depression and anxiety. Okay, so now I just kind of want to fit this into the larger meditation base and bring it, the literature, and bring it kind of around to how it works in adults. So there's been quite a bit of research on meditation in adults and what it does for the brain. And what we see is that it changes the prefrontal regions. That's the orange region at the front of the brain, if you can see that color. It also changes the orbital frontal region. It's the green part on this brain, if you can see it, just kind of behind the eyeballs. So the prefrontal region is your higher level cognition. That's your reasoning, your planning. It's your meta awareness, being aware of your own thinking, your own emotions. It helps regulate attention and emotion. And then the orbital frontal cortex integrates your sensory experiences. And it's also involved in emotional regulation. We see a lot of atrophy in this region in people who have bipolar disorder, for example, and have difficulty regulating their emotions. That's that frontal region. So again, the front part of the brain, we see a lot of changes. And across studies, they have seen increased activity in this area, increased connectivity of this frontal region with some of the parts of the emotion centers in the brain, the amygdala. We see heightened meta-awareness, so being able to step back and observe your thinking and your emotional processes. We see a reduction in emotional reactivity, that tendency to kind of get stuck in your emotional experiences and not be able to move out of them. And the meditation reduces this and reduces the depression and the anxiety. So you have a healthier brain communication and stronger frontal lobes that help control that. Some of the other areas that are seen across multiple studies in meditation are the anterior cingulate cortex. That's the part of the brain, it's a kind of further deep down into the brain, right around the emotion centers, the inner part of your brain. So the cingulate cortex is involved in focused problem solving, so being able to attend to something and really focus on how to solve the problem, your emotion and self-regulation, And the posterior, or the back part of this cortex in yellow, this is involved in self-directed cognition. So we did see changes in meditation across studies in this area, and other researchers have as well, where the cortex becomes thicker, the connections between the neurons or the brain cells are more integrated, the areas become more active, and then in the back part, we see a decreased activity. Now again, this is the part that's focused on the self. And again, this is the part that's active in depression and anxiety, where you really get stuck on the negative things about yourself. So with meditation, we see a change in this functional interface, this area, this functional interface between our emotions and our cognitive regulation. We see more objective self-evaluation with these changes, the strengthening of activity in the front part and decrease in activity in the back part of the cingulate cortex. And again, we see decreased depression and anxiety with these brain changes. So this front part of the cingulate cortex, it's involved with physical sensations and emotions, your thoughts, and how they intersect and how they fit in the wider picture of the world. And the PCC, or the back part, the posterior cingulate cortex, is implicated in that self-referential distortions that we see in people with depression. And it does play a role in anxiety, so that decreased activity there is good. The other areas where we see changes across studies are in the amygdala, which for those of you who can see it is this red part, and the hippocampus, the yellow part. We have an amygdala and a hippocampus on both sides of the brain. And the amygdala is the emotion center of the brain, and it's also the fear center. So it's very much involved in anxiety when it's dysregulated. So we see a dysregulation of the amygdala in depression and anxiety. We see that the amygdala may be more active on one side, usually the right, and has less connectivity with other areas of the brain that regulate emotion. We also see the hippocampus, the part that's involved with memories. With depression and dementia, we see atrophy in this area. Well, meditation works to make these centers more integrated, less active in the fear center. It down-regulates the response to your emotional stimuli and allows you to have a more controlled response. Another area of the brain is the striatum. To see this, you would have to cut the brain in half, take the front and the back apart, and then look at it. So it's kind of inside the brain, deep in the cortex, and the striatum is involved in attention and emotion. With meditation, we increase the gray matter volume, or the brain cells in this area, and we see less atrophy in this area. So meditation turns this system on. And what this system does is it allows us to savor the moment, to be in the moment, and also to sustain positive emotions. So to hook onto those positive emotions, identify them even in bad times, maybe the rose smells good, identify that, and focus on that. The final part of the brain that we see consistently changed with meditation is the insula. The insula, again, you would have to cut the brain in half and take the front away from the back, and then you can see these kind of crevices. It's kind of the connection between the parietal lobe on top of your brain and the temporal lobe, which is at the side of your brain. And in there, there's a lot of, it's curved in, there's a crevice where it gives you more surface area. This area is involved in body awareness, but it's more than just body awareness. The insula provides us a multi-level integrated meta-representation of the state of our entire body, as well as the sensations and perceptions from outside, and it puts it in a broader context. It integrates information from all over the brain, so your cognitive states, your emotional states, your motivational states, and it allows you to maintain balance. So in depression and anxiety, especially the right side, the right insula, is hyper activated. And it has decreased connectivity to the regulation regions of the brain. So mindfulness meditation increases the thickness in this area in experienced meditators, but in new meditators, it increases the activity. Just focusing on your breathing, like I talked about, dampens that self-referential processing, and especially negative self-referential processing. So you have a negative thought about yourself. Well, I'm not going to think about that. Instead, I'm going to focus on my breathing. And that helps just kind of dampen it. It also provides us emotional awareness, again, allows us to be a little more objective in our self-evaluations from the changes that we see in the brain from mindfulness meditation. It also changes the alpha frequencies and allows efficient processing of that kind of integrative thinking about our body. The insula, people who have a stronger insula are actually able to get into that mindfulness state a little easier, but even novices, as they meditate, this area strengthens, and that can lead to being mindful in your daily life, which can be very helpful in enjoying the moment. Just be in the moment, enjoy the moment, and kind of don't let that negativity get to you. Be very kind of disengaged from it. Okay, so overall, there's a difference between meditation and mindfulness. So meditation is a systematic practice, and there's actually a lot of different types of meditation. There's mindfulness meditation, there's focusing on sound, there's body scan meditation, there's walking meditation. So there's a lot of different meditation practices. I tend to use a mindfulness meditation. It's supposed to be very good for patients who have atrophy. So the meditation is actually setting time aside to sit down and meditate, or to take a walk and meditate, be in nature and meditate. So the meditation trains our mind to be focused. It develops attention that's under our control. It trains us to be present in the moment. It trains us to acknowledge and accept emotions and thoughts non-judgmentally, by kind of stepping back and looking at them as if you were observing a character on TV or something like that. So meditation nurtures our focus and our mindfulness. Mindfulness is actually a mentality. It's when we have a heightened concentration on the present. We're very focused in the moment. We're calm. We have an awareness of our sensations and our feelings, but we're not letting them overwhelm us. We observe the moment without interpretation. So mindfulness is being purposely present without judgment. Someone cuts in front of you in line, well, yeah, maybe it's slowing you down a little bit, but you just kind of observe how you feel. You observe what that person's doing, what other people are doing. You turn and you look at the roses that are, at the checkout counter instead. And you focus on that. You focus on your breathing and what you're feeling, what the sun is like on your skin. So mindfulness is a mentality, whereas meditation is the practice to build that mindfulness. Now, as we saw, meditation is very important for your brain health. It does cause changes in the structures and the functioning of the brain that are related to your attention regulation, your emotion regulation, your body awarenesses, and your self-perception. So we see thicker cortex in some areas, we see shrinking in some areas of the brain, but it's good shrinking, it's shrinking the fear center. We see shifts in the brain that allow for more positive activity in the brain. We see shifts in the brain for enjoying the moment. So that mindfulness practice provides a counterbalance to depression and anxiety in the brain. Now, again, I mentioned that I wanted to bring it kind of very directly related to you. There's not been a lot of mindfulness study in PCA patients, of course, because it's difficult to do research with us scattered all across the country. However, they have started doing mindfulness meditation with other dementia patients. And what they've seen is in long-term meditators, there's less atrophy in their brain. Now, we're talking about meditators who have meditated for 20 years. Their brain can actually look like a brain of someone who's 7 or 10 years younger than them in the atrophy. Now, this could be due to meditation helping to preserve the brain cells, or it could be that people who choose to meditate just simply have healthier brains to begin with. So this doesn't tell us the cause by looking at this study of less atrophy in long-term meditators. But there are other researchers who have done pre and post-test studies with novice meditators, people who did not meditate previous to the study. And what they saw was with short 8 to 10, 15-week meditations, this one I believe was 8 weeks, they saw increased gray matter density, that's the cell bodies. So they saw a greater density of cell body structures in the areas that were associated with memory, self-awareness, and introspection. They also saw decreased gray matter density in the amygdala, that fear center of the brain. And it was correlated with the reported reduction in stress. So even in novice meditators, we're finding that it seems like we have stronger brains and less atrophy occurring. They also have done a study with participants who have mild cognitive impairment. Now, mild cognitive impairment doesn't mean that you have dementia, but you may have some of the symptoms of it. And I think it's about 50% of those who have mild cognitive impairment do move forward and develop Alzheimer's or another dementia. So in this group of participants, they were non-meditators. They were introduced to the meditation. And what they saw was a change in the increased functional connectivity, the communication between the frontal regions and the back regions of the brain. They saw increased functional connectivity in the regions that are most affected by traditional dementia. They also saw a trend toward less atrophy than controls. Now, again, this is all with people who have more of a typical dementia, but it is talking about atrophy, that it seems to slow down atrophy. And there is actually a new study where they had a single meditation session, and that improved the visual short-term memory for faces. Now, of course, that probably isn't going to persist unless the people actually continue to meditate. But we are seeing evidence that meditation can improve the connections in the brain and slow down atrophy. So that should be very interesting to all of us. We want to slow down that atrophy from turning into a more traditional dementia. It also just helps us with healthy brain aging, helps our brains look a little younger, which means act a little younger. Now, I do want to put in a caution here. Meditation is generally safe. However, there is a new study that found about 8% of new meditators report an increase in anxiety and depression. But that means that most meditators do not. However, it's recommended that you begin your meditation under the guidance of a professional. A lot of therapists offer meditation. and also just someone who is very informed on meditation processes can make sure that you're doing it properly, that you're not actually activating parts of the brain that may cause the anxiety or the depression to increase. That 8% rate, that's about the same risk as if you go to therapy. Some people who go to therapy, talking about it makes it worse. But it's a much lower risk than medications and medication side effects. So this is the point where I was going to recommend you begin your meditation journey and the guidance of a professional, and I was going to hand you off to Bonnie. But Bonnie is not here. So I'm going to just kind of go over a breathing exercise that we use with meditation. It's not going to be a real formal meditation. It's just going to kind of introduce you to the ideas of meditation. So I'm going to stop this screen share. Okay. All right. So again, much like I talked about in my talk, I would want you to sit up straight. You want to open up the lungs a little bit, sit up straight, but make sure that you're comfortable and just relax your hands in your lap. If you're comfortable, you can close your eyes. If not, I want you to kind of look down just in front of your feet if you're sitting up, or just in front of your knees if you're sitting on the floor. So your eyes should be looking down a little bit if they're not closed. I want you to begin taking several long, slow, deep breaths. I want you to breathe in fully. Breathe in through your nose. Exhale through your mouth or your nose. Allow your breath to find its natural rhythm, so don't force it. Bring your full attention to noticing each breath as it enters your nostrils. In, it's traveling down your lungs, causes your belly to expand. And then notice each breath as your belly contracts and the air moves up through your lungs and out through your nostrils or your mouth. Bring your attention fully to your breath and the sound of my voice in this case. Notice how when you inhale, it's different from when you exhale. You experience the cool air as it enters your nose and the warm air as you exhale. Turn your focus deeply inward. Let go of everything around you. If you're distracted, you notice it. And then bring your attention back to your breath. In, out. In, out. Don't try to control your breathing. Just observe it, your experience, the moment. Don't judge yourself if your consciousness shifts. Pay attention to the inhale, exhale. And as your mind wanders to thoughts or plans or problems, notice that wandering. Watch the thoughts as they enter your awareness as neutrally as possible. Let go of them. Think of those thoughts as a leaf that's floating by in a stream. You can't control them. You're not particularly attached to it. You just watch it. And then bring your focus back to your breathing. In, out. In, out. Now, as your mind wanders, I do want you to observe the type of thoughts that hook you or distract you. And when you run into that, I want you to visualize yourself stepping back and observing that thought or that emotion from a distance. And then detach from it and focus on your attention again. Watch the gentle rise of your stomach on the in-breath, or feel it. And the relaxation letting out as you breathe out. Follow your breath as it flows in and out. Breathe in and out. In, out. In, out. Now I want you to shift your attention to your body. And as you breathe in and out, I want you to just kind of relax your body, starting with your head, your neck. Relax your shoulders. Let your arms relax, your legs. Feel the floor under your feet. Feel what the inside of your shoes feel like, the coldness of the floor. Pay attention to the air that's on your arms, your face. Just be present in the moment. And if you get too distracted, breathe in and out. Now I'm going to let you breathe for just a few minutes. Breathe in and out. Okay, and then when you're ready, you can open your eyes or lift your head. Become more aware of what's going on around you and try to keep that calmness and know that anytime that something is distracting you or overwhelming, that you can just do a couple deep breaths and focus on that and use that as an anchor to be fully present in the moment. Okay.
Thank you. Crystal, that was awesome. Could you just address like how you feel that PCA and your meditation has gone?
Well, at first, before I had my diagnosis, it was very difficult to just be at peace with what was going on. But after I got my diagnosis, it actually made it easier. And, using that mindfulness, I of course, I was sad. I was angry. I was, worried about the future. But it also allowed me to really kind of let go of who I had been and focus on what I could still do. So one thing that's always been very beneficial for me is going to the ocean and just watching the waves going in or out, or to the waterfall, and just being present with that. Also just being very present with, as my vision has kind of changed, the sounds around me, the birds chirping in the morning, being very aware of how every moment is precious. And so I really just want to be very aware of that, be very peaceful with it. I've been able to kind of disengage from what I'm going through and watch it from a distance, just because I have that mindful experience, which means that it doesn't hit me quite as hard. I'm able to observe the changes in myself, really with peace, just knowing that, we've talked about this in group one. I'm so lucky that the kind of atrophy that we have and the visual problems that we have are very different than a traditional dementia. And we're still able to do a lot. And it allows us to really tune into the sounds and the feelings, and even the shifts in how things look, and really see the beauty in it. So having that mindfulness experience, I think it has allowed me to kind of just step back and just observe what's going on. And then I'm a scientist. Honestly, I find it very interesting what's going on, and hearing other people's experiences and seeing how things shift, how I can see a pill on the floor, but I may not see the wall, that, you know, the doorway. So I find that very interesting, and I just kind of sit back and watch it and try to see the humor in it, in the fact that I can see that tiny thing, but not something big like the wall. So that's.
Thank you. I want to open it up to questions. And if you have a question, raise your hand and unmute yourself when I call. Any questions? I know Gwen is a meditator as well. I'm sure she has some experience. Any questions from anybody for Crystal?
Am I?
You're unmuted.
I guess one of the questions that comes to my mind is, and I think you may have answered my question too, whether when you meditate, does it make a difference whether you have music, using music to help you meditate versus concentration to the mind without any you know, any sound? You know what I mean?
Okay.
Like,
Yeah. So what you're asking would be related to that focused attention meditation versus that open monitoring meditation. And with the focused attention, you have that anchor, a sound, for example, the music. That would be more of a focused attention where you're really focusing on something to keep you in the moment. And that actually does affect they both affect some of the same regions of the brain, but that kind of meditation actually strengthens your attention. Whereas the open monitoring meditation, where you're just kind of experiencing everything around you and trying to do it in a non-reactive way, that actually builds mindfulness in your daily interactions. It builds that ability to be kind of detached from your emotions in a healthy way and observing them. So they do affect different regions of the brain, some of the different regions of the brain. I personally find it easier to have some kind of anchor. I love to meditate in nature, like at the beach, where I can have the waves that I can kind of focus on, or a waterfall, for example, or the birds chirping. My brain moves very fast, and so it's just easier for me to have that anchor to attach to. But they're all beneficial. All types of meditation are beneficial.
so it sounds to me that that doing both is a good way to approach it. Am I
Yes,
right?
and actually, yeah, for new meditators, it is easier to do both, to do what I did with my kids. I was working with second graders, and so, you know, their attention's all over the place. So it does actually help to have that anchor, but then to allow yourself to not punish yourself for your mind wandering, to not punish yourself for having emotions. Allow yourself to feel them, but not overreact, not get stuck on them. And when you start getting stuck, shift to that anchor, whatever that is, a sound, a breath, whatever you choose.
Thank you.
Can y'all
Jamie,
hear me?
Yes.
Can you hear me?
No.
Can you hear me? This is Dolores.
Yeah. So,
I just want to tell you, Gwen, Crystal, that was amazing. I needed that so much today. Thank you.
Thank you.
Well,
Ed,
thank
go ahead.
sorry.
Go ahead.
Yeah, I was just going to say that I'm in the UK, and I really enjoyed that talk. It was fantastic. Thank you. What I use an application called Headspace. I don't know
Yes.
if you come across it, but I use that every day, and I find that incredibly helpful, and it gives me peacefulness and helps a great deal. I would recommend it to anybody really. It's incredibly useful.
Wonderful. And it's
Yes,
called Headspace.
Headspace, yeah. Whether it's in the US, I'm not sure, but
it is.
oh, okay, great.
Yes.
Yeah, I would recommend it to anybody. I do 10 minutes a day, and it gives me an immense peace of mind. I love it.
Yeah.
Wonderful.
So
Any-
there are a lot of apps like Headspace. That's one of the more popular ones. There's also a lot of guided meditations, just even on YouTube, that you can find. They have visualizations, ones like where you're floating in a hot air balloon. They have, again, the ocean's a big thing for me. So they have the ocean ones, walking along the ocean. So there are a lot of great resources to help you have that attention and develop that mindfulness.
Awesome. Thank you. Any other questions before we come to an end? If not, I thank you so much. If anybody is interested in learning more, I see a couple people who are not in our support groups. If you're interested, you could email me at jtalon, TALAN 3K at AOL, or if I've spoken to you before, I will send you an email for our next support group. And it is a private support group, so it will not be taped. This is taped and will be online for people to observe it and grow from it. Crystal, thank you so much.
Yeah, I did want to say one other thing, because I know there's some people in the group who I have talked to. So having PCA does affect doing things like this. The only reason I was able to have the slides that I had is because PowerPoint now has this thing that you hit design ideas. So I just speak the information, it puts it on the slide, and it will even pick pictures for me, and it designs the slide for me. And so, we have to adapt, but we can still do the things. And also, I would have done a presentation like this. It would have taken me a day, maybe 3 days to do. I have worked on this for a month. And so PCA does change what you're doing, but you still can have success. Dolores and I have talked about that.
Wonderful. Well,
Okay,
thank you so much. Thank you, guys. Thank you for participating, and we will speak to you soon.
Thank you.
Awesome job, Crystal.
Yeah,
Thank
for
you.
sure.